Hey, y'all. Welcome to the Medical Report, where we bring health to your ears. This podcast is brought to you by our sponsors, Interval Care Medical Services, Shabazz Home Health, Graceful Hands Rehab, and Bantucola. Our podcast hopes to help the community learn more about health, but we do have a disclaimer that all medical advice shared here is not an adequate means to diagnose or treat you. So we do recommend you seek medical attention if you need so. If anyone in the audience has any questions for us individually or about our topic today, please feel free to leave your question in the chat and we'll answer it in our Q&A segment later in the show. Also, be sure to like and share this video. We want to feel the love. Since this is our first episode, I want to give everyone on our panel the opportunity to introduce themselves. So I'll go first. My name's Anita. I'm a nurse practitioner. I'm the owner of Interval Care Medical Services. We do provide telemedicine services in Florida and California. And we'll pass it over to you, Zinzele.
Hi, I'm Zinzele Shabazz. I'm from New Life Therapy. We provide speech therapy services, whether that's in person, like home health, or it's online for cognition, dementia, speech, swallowing, medical based.
I'm Olukade Olufayo. I'm the owner and CEO of Graceful Hands Rehab. We provide mobile physical therapy, occupational therapy, and speech therapy in the Southern Maryland and DC area. I also have a dietitian, in case anyone is looking.
Yes. Okay, so let's get started. Today, our topic is about COVID-19. I'm sure everyone knows about COVID. This is something that everyone's aware of since we are continuing to attempt to get back to normal with the pandemic. So those who have had COVID may have been asymptomatic, lost taste or smell, had flu-like symptoms, dry cough, difficulty breathing. But unfortunately, we've also had those that have lost their lives to this. So COVID has affected us all in different and similar ways. Some of us have lost while others have been able to pull through, but we've all gone through this in some way, mentally, physically, socially, financially. The list goes on and on. But currently, there are 33 million cases of COVID in the US, and 36 or 63% of adults in the US have had at least one vaccination so far. So that's a good victory for us. But how do we get back to feeling like normal, you know? So today we're going to go over some facts. That brings us to our first segment. Miss Zinzele, take it away.
All right, this is news from the hat, and I promise you next time I'm going to have a hat. So if you're just joining us, please like and share the video and leave a question in the comment section that you'd like us to answer later in the show. To start, let's talk about face masks. I don't like them. I got to wear them, but it's all right. On May 13th, the CDC announced that fully vaccinated individuals no longer need to wear a face mask or socially distance, whether indoors or outdoors, except where required by business, public transportation, or state law. But then they bounce back and forth on that one, so who knows? Additionally, fully vaccinated people can refrain from testing following a known exposure unless they are residents or employees of a correctional or detention facility or a homeless shelter. But we won't get into talk about how they're handling correctional facilities. Unvaccinated must remain in mask as they continue to be considered to be high risk. That's one thing.
So, I mean, lately I've been seeing a lot of people out in the grocery store with their masks, not wearing masks and things like that. So I think people are becoming more comfortable with just not wearing their mask. Obviously I'm hoping that they're vaccinated. But then there's that fear that unvaccinated people are saying they're vaccinated and not wearing their mask. And why?
Because they just don't want to wear it. Yeah.
I don't trust anybody, so...
He said, I don't trust anybody.
You don't trust anyone.
There's still a small risk.
Trust no one.
Contracting the virus. And I'm going to keep my mask for a little while.
I'm keeping my mask for a whole year. Because when I do end up getting the vaccination at some point, I do plan to get it at some point. But like I was talking to you guys before, I just don't want to be that person on there talking about, call this number if you had this such and such vaccine.
So you chose not to get the vaccine.
Yeah, not yet. It will. I will. My kids will get it, but not me.
Yeah. Just need a little more reassurance.
Yeah.
First. Yeah. So I got the Pfizer vaccine. The first time, my first dose, I think I had no symptoms. But my second dose that I took, I had a slight headache and then some, I think just a slight headache. Yeah. And then I was tired and that was about it. But that was like 2 hours after I got the second one. Then then everything was fine. So,
Yeah.
but I'm glad I got it though. Definitely. Olu, did you take the vaccine?
I did. I took Moderna. My experience with it was so okay. The first shot, maybe later that night, because I got it in the morning, I was, kind of fluish. And then by the next day, I was fine. I was just a little bit tired. The second shot, I got it in the morning. I had nausea for most of the day. And then I had the fluish symptoms again, but it wasn't as bad as the first one. But it was all over by the next day. So it
Right.
wasn't a horrible experience, but yeah, I got Moderna.
It's doable.
Yeah.
But at least it seems. I mean, over half of the adult population is vaccinated, so we're going in that direction, which is good.
So therapy, right? Getting into some of the things that we do. Chris, Chris? Olu, what are some of the things that you've seen in your treatment?
So I've worked in the hospital setting and the nursing home setting during this whole COVID thing. And, I've gotten to see what really bad COVID looks like. So I just feel like, wear your mask. It's not worth it. But as far as
Absolutely.
physical therapy, uh, a lot of them have long term cardiovascular effects. You're going to see a lot of COVID long haulers, is what they call them.
Yes,
People with respiratory failure and a few other really cardiovascular issues too that are going to continue on well past this pandemic. Ebony's vaccinated.
okay. As people wonder, well, how could speech have anything to do with COVID? But when it comes to speech in the medical setting is dealing with your swallowing, and a lot of COVID patients have upper respiratory issues. And so another thing that's happening is a loss of taste and smell. And the CDC is reporting that a new loss of taste or smell has been added to the COVID-19 symptoms. And now early data from recovered patients is showing that many may not actually recover those senses. I was talking to a lady in a nail shop, believe it or not. I was talking to a lady in the nail shop. Usually you recover after 2 weeks, but you can actually not recover from having your loss of taste and smell. So
Yeah, I
there
was
are
reading a
certain
study
things that
on
she
that.
can't. Yeah,
Yeah, there. I mean, there's studies out that actually say that even patients after they have got, done the recovery period, they're having symptoms up to like 3 to 4 months after, and they're calling it
yeah,
like the COVID, continuation or long term effects basically of COVID.
Well, long
So,
haulers.
you
the
know,
long haulers. Yeah.
right. There's some people that have had it, they had a lot of respiratory issues during the actual having the virus, but then they continue to have that afterward, even after they recover.
So
So,
Catrice Johnson has a question. She says, I haven't been wearing my mask because I did get the vaccination, and they said if I got the virus, I would be less likely to die. Is that true? And why are medical professionals not getting the vaccine?
I would say, to answer at least the first part of her question, she's following exactly what the CDC says.
Yes.
So, at that, leave it at that. Now, as far as the second part, and why are medical professionals not getting the vaccine? Um, I work in a nursing home and I still work a little bit in the hospital and I have my business as well. And most of the people that I know that around me are vaccinated.
Well, to kind of answer it as well as I work not only with New Life Therapy, but also in post acute and hospital setting. And a lot of people may not know this, but they're not required.
Hmm.
It's their personal choice. Flu
yeah.
before COVID came along, medical professionals could choose to have a flu vaccine or not have it. So they're doing the same thing with COVID.
Yeah, right now there's so many unknowns with the vaccine, so it's hard to mandate that. But I do know that I think they recently actually came out to say that companies now are able to like mandate people to have the vaccine in their companies. So I mean, I guess it just depends on where you work too, whether or not they're going
Yeah.
to allow you to have that basically freedom, or they're going to say, look, you work here, you have to have this vaccine. And then if the CDC did say that you can walk around without your mask in an indoor or outdoor space if you've been vaccinated, but you also have to be mindful that you should still be social distancing as much as possible. So even if you're in a space with other people, you need to be mindful of how close you are to people, because that contact, depending on the vaccine you got, the Pfizer and the Moderna, you have a 5% chance of still contracting the virus.
Oh yeah.
Very low percentage, but it's still there. So
Yeah, the lady was sitting close to me in the store the other day. I was like, back up.
yeah,
Back up.
exactly. I'm like, I need them 6 feet though. Let me get those six
Right,
feet.
right. And then, I feel weird because
Okay,
right
Abby.
now I have a cough. And so I have to take a COVID test every week where I work at post acute. So I took my COVID test and it came out negative and everything. But then I'm around people. I'm like, oh, I can't go out to eat. I'll cough.
Yeah.
It's sad. We can't have a cold.
Right. Because then it's like, wait a second. What do you have? You know, any
Yeah,
cough could be a cough could be anything. I mean, there are other things around that were existent before COVID. So
yeah.
it's always just
Just
hard to
drank
kind of
some
tell.
water and then went down the wrong pipe.
Right. That part.
Ter- Teresa
Gotta hold it
Garcia
together.
Sandoval said, what are your thoughts on the vaccination for children under 12? And has there been talk with how soon this will come out?
So, kids under 12, so far, there isn't anything on that. So, on May 17th, over 600,000 kids had received their first dose of the Pfizer that were aged 12 to 15. And June 3rd, as of June 3rd, 5.8 million teens have received at least their first vaccine dose. But on the other hand, CDC study stated there's been an increase in hospitalizations of patients that are 12 to 17-year olds. I don't really know if there's anything so far as recommendations of when they're actually going to release the vaccine for the younger ages. But hopefully it'll be in works once we have a little more uh, realization of how it is with the 12 to 17 crowd first.
Yeah. Dixon House says, I'm in recovery and I continue to have symptoms. I go through phases of feeling fine and then having symptoms. When those symptoms, chills, body aches, etc., arise, should I quarantine again?
So if you're having symptoms again, it may be wise to get tested again, but I guess it would kind of be difficult to tell since you just recently had the virus. Because sometimes people will test positive longer than 10 days after. But they usually will say once you've had the virus, 10 days later, you should be good to go. Um, but
I'll say
I mean, that's
this.
how you're supposed to quarantine, at least until your symptoms are gone and your fever's gone and all that stuff.
Yeah, I agree. I'll say this. I've had COVID in the past, um, and my experience was that even after the 2 week quarantine, you still had a few symptoms, um, but they weren't as serious as when initially the symptoms came up. Um, so it's tough to say. If I could have taken a little bit more time off because I don't want to infect anybody, I would have
Right.
probably taken more time off. But I was like, I'm well outside the 2 weeks, and I still made sure I kept my distance from people, and I was really vigilant about like washing my hands, and I would go eat my lunch in my car and those sort of things. So I don't know.
I
I was
mean,
just
I think
following
that
through.
if you're still having symptoms, it like we talked about earlier, it could just be that post COVID symptoms that you continue to have. I feel like if you begin to have more symptoms on top of those, then that may indicate you may be reinfected. So then
Yeah.
that may be wise to quarantine.
Catrice Johnson said, I got the Johnson & Johnson vaccine right before the announcement of there being a problem. Should I be concerned that my batch was bad?
Oh, so
Unfortunately, right now, there's no way of really knowing
I
yeah,
don't
that
think
I'm
that
exactly.
there
aware.
are. I don't think that there are any bad batches.
It's just that
Um,
there are people that are more prone to the clots. That's really what it is.
yeah. So I think what was it, 9 women out of like 7 million people
Yeah.
have
Yeah.
taken.
It was a small amount of people that ended up getting those.
That was very, very
There may have been
rare.
a predisposition to something that, they
Yeah,
had to make a change to.
Yeah, and that's the
yeah,
thing about the vaccines right now. It's all still in works of what conditions that people either already have or genetically you know, what their makeup is genetically.
Well, I know they were
How
trying to
we
get a lot of the
react.
African. I know they were trying to get a lot of the African American community to come out so that they could like test because genetically it's different. So
I think it's just because the Black community was so hesitant initially, mainly because of the whole
absolutely,
Tuskegee experience. So, Tuskegee experiment, sorry.
yeah,
So it's like, everybody was kind of hesitant initially because they didn't want to be the guinea pig. But
right,
if we don't have anybody that's Black to even put in there at all to say this is going to be okay for us, then it's hard to
right.
say that it's safe for us.
Exactly.
But
Now,
as with the J&J vaccine, it was restarted on April 23rd after that mandatory hold they did for a week, and the FDA did the whole like uh, investigation on it. And now all they did when they restarted it was they basically placed a new warning saying that it has a risk for rare serious blood clots in women that are under 50, because those were mainly the women that were found to have those clots.
gotcha.
Yeah.
Well, in post acute, what they're doing is when you come out of the hospital, if you haven't been vaccinated, then they'll quarantine you. They quarantine you for 14 days in a bubble of plastic around. I feel bad for them because they don't. It's not that they have it. It's just they don't know if they have it, so they can't
Yeah.
mix with the general population. So if you have family members that are in post acute, you're probably not able to see them right now, but yeah.
Yeah. So, Olu, do you have that fact of the day?
I do have that fact of the day. Anita Zenzele, did you know that COVID-19 antibody titers, COVID, come on, let me get it out.
Okay.
COVID-19 antibody titers are 10 times higher among patients that have had the vaccine versus those who have previously been infected by the virus. Also, those who have had COVID 19 must wait 90 days before they are able to get the vaccine.
Yeah.
All
I waited
right.
my 90 days before I got Moderna. Um, I've been fine ever since. My suggestion, please go get vaccinated so we can get back to normal.
Right. So I kind of wonder, Olu, when you got COVID, did that kind of
Mhm.
sway your decision to go ahead and get the vaccine?
It did. I was skeptical in the beginning, like a lot of people. And then this was around the same time that I started working in the hospital and I got to see what really severe COVID looked like. And then I got COVID and I kind of felt it. It wasn't like the flu for me. I had the shortness of breath. I had everything. Even my daughter got infected. My wife got infected. So I knew that the next time that the vaccine was available for me,
You're like, I'm going
that
for it.
I'm
Yeah.
going for it. I'm like, I
I'm
don't want
going
this
for it.
ever
Done.
Yeah. Yeah. We're
Yeah.
just like quarantining in our own way. We're like, staying away, wearing our mask, all of that. And
Yeah,
I don't know. Once I get more comfortable with how
we'll
this
do
is,
all of
yeah, how it's being rolled out, even when I'm vaccinated, I'll still do the same thing. I'm still going to wear
I'm the
that. Trust
same. I
me.
mean, I'm vaccinated and I definitely wear my mask. Sometimes I double mask if I feel like I need to. I'll be like, hang on a second, let me get this surgical and this cloth one. Okay, we're
Well, it
I go
good.
to
cracks
the
me up for
grocery
the
store
people that
and
have
tell them to try.
the people that have the face mask and then this mask and then them
Right?
glasses. They got
I
the
think
all three combo.
everything
I'd be
done.
like, nah, it's not coming over
Protect.
here. Yeah.
What gets me are the serial killer masks at the grocery store.
Oh.
The ones you only
Right? Where
resist.
it's just like yeah. I'm like, come on, man. In any other
Like
circumstance, that would be scary. You walk through the door.
you're trying to rob
Yeah,
the safe,
absolutely.
you're trying to get milk.
Right. It is what it is. All right, so we're gonna go ahead and go to our Q&A session, even though we've kind of been Q&Aing through this segment.
Yeah. Yeah. All right. Anybody got any questions out there? If not, I have some things we could address probably.
Mm-hmm.
So until y'all start chatting, let's see. What do I do if I lose my vaccination card? Ooh. Mm.
So if you lose your vaccine card, Check with your local county health department. That's a good start because when you go and get your vaccine, you're gonna go and um, they're gonna be registering you in this whole system anyway. So the county health department should at least have your information, and they can give you like a printout, paper printout that you can take with you. It may not be another card because I know they're trying to decrease that whole duplicate card situation because they
Right.
don't want fake cards going around anywhere.
I can see
Um,
people now with their little fake cards.
it's probably already happening.
Oh, for sure. And
But yeah, the county or the hospital where you got your vaccine should have a record and should be able to give you another card.
Right.
okay.
Yeah.
Yeah, exactly.
Yeah.
Don't go print a fake card.
No one prints a fake card.
You know they will. You know they will. You know folks are printing cards.
You know?
Oh,
Well,
About went to a pharmacy. Chris asked,
what about if you went to pharmacy? So even if you go to a pharmacy, they still have to register you. Because like whenever you get your vaccine and all that stuff, they register you in this database. That's even when you take a COVID test. Like when you go get your rapid tests and stuff, you get registered in the database.
yeah, wherever you got
they
it should be
follow
able to
you.
give you some record of the fact that you got it there.
Mm-hmm. Yeah,
You
that's
can
true.
get some type of documentation, paperwork or something.
And then like just think if you had your vaccine card, take a picture of it in your phone. Or make a scanned copy and put it in your email. You know, that way if you do lose it, you at least have some type of backup. Or even tell your doctor's office if you went to a pharmacy, go to your doctor's office and let them know you got your vaccine so that they can document it in their system as proof. Something.
Or you can say, why are you worried about it? Back up.
Give yourself some backup options.
You're
Something.
vaccinated in some back alley. You're not gonna get a card. So
They marked on
yeah,
my
2 months.
vaccine card. They marked my vaccine number 1 twice. I don't.
It just, girl, it just mean you special.
I mean, I don't see why they would do that. But I mean, if it's on there, they actually end up writing the lot number too. So I would think the lot number should probably be different. So if there's 2 different lot numbers, which is the kind of the identifier for your actual vaccine, because they keep track of those too. Because if you have all these symptoms, they go back and see, oh, you had this lot number, was that a bad batch? And then that's how they track it. So I would think that they would have a different lot number on your car, which could help indicate that it's a different one than the first one. So hopefully you should be good. I think you're good.
Chris Hendricks said, what's the difference between the rapid COVID test and the PCR?
I have an answer for Chris. So I've taken both the rapid and the PCR test. The PCR test is the one, I guess, depending on which stick they give you, they could stick it all the way back in your nose,
Right.
or they could do the thing where they kind of just rub in there. That's the one where they send off to a lab and they test to see if you have COVID. That's, I know for a fact, is more accurate than the rapid test. The rapid
Correct.
test is exactly what it sounds like. It's a rapid test. You're going to get an answer fast. I just know that there's a higher rate of like false negatives or false positives. I want to say it's false negatives.
False negative.
With the rapid test, but the PCR test is the gold standard of COVID tests.
Right. The rapid tests are what they're giving to employees like myself on a weekly basis. They just want to give you something and make sure, you know, so far you look pretty good. So far you look pretty good. But if you start getting symptoms, PCR.
Yeah.
We actually
Well, they said that the rapid is more effective if you've had symptoms and then you get the rapid. But if you take the rapid and you still have symptoms and then you take the rapid and it's negative, then they recommend that you take the PCR because that one's more accurate. They test different things. So the rapid will test like the proteins of the virus, and then the PCR tests the RNA, which is like the genetic material of the virus. So I think that's why it would be more accurate. I was like, why is this always happening to me? Right?
It's just me.
For real.
Let's see. Did I have another one?
Took a picture after I received the second shot. Yep. That's a good idea, Naomi.
Go get your free donut at Krispy Kreme's.
What?
Yeah.
Why are they offering free donuts?
the vaccine. I've been there 2 or 3 times already.
So
Oh,
all
we
you
can
got to do is
check
flash your
the card.
card, and they give you a
Yes,
free donut.
yes.
I don't even like donuts. I'm gonna go get one anyway. Just so I get my freebie.
Yeah, I'm not a donut eater, but it's all good.
No, no. I'll bring it home to the husband. That's the best I got.
What are your thoughts on vaccinating children as young as 12 years old?
Since there's not enough research out here right now, I don't even know if the doctors are doing it.
No, they are. So 12
They
to
are.
17 right now. They're vaccinating
I
12 to
think she said
17.
young as 12, like 12 and under. I was kind of what I was thinking.
12 and under.
Oh, I thought they were just saying as if they're 12.
Young as 12, yeah. But yeah, they can go in if they're 12.
I mean, if they're 12, they can get it. And
If they're
technically,
11, mm,
the studies right now with Pfizer and even Moderna put out studies on, theirs as well on these 12 to 17-year-olds. And they're supposedly saying it's 100% effective for the kids.
Yeah.
So it seems to be a good thing. And no one's necessarily put out any major side effects from it.
So now, if we're talking 12 and under, um, me, I have a 2-year-old. I just my personal thing. I probably would wait, but if I had a kid older than 12, I would be more comfortable letting that kid take the vaccine. But my 2-year-old, like, nah, not yet.
yeah, yeah,
Yeah.
yeah, yeah,
My kids, I don't think I would right now either.
yeah,
But I mean, I think it also depends on how active they are in the community as well. Like if you have them, doing like sports and like the whole nine, and
yeah.
you know that you're going to be out and about, maybe you may want to definitely consider that. But if you're able to, you know, kind of keep them distance and be in your own little circle of people, that's a little safer, then it may
Now,
be
my
more.
son, he's going to be playing football in high school. So I'll go ahead and get his vaccine shot and everything going, get him ready for football coming up. But my daughter, I'm a little concerned about people that already have medical conditions, whether it's neurological. She has autism. So she's 16 years old. She has autism. So she has also some few medical conditions. So I'm not really sure if I want to risk her mental with some of the side effects that could happen. I don't know yet. I'm little hesitant on that one, but my son, he'd be all right.
Okay, so the testing has been done mostly on white people. Is there a different genetic makeup for Black people where the vaccine could be ineffective? We
I
don't know
wouldn't say
that.
ineffective. Yeah, I wouldn't say ineffective. It's just that I do know that the Black female that was part of creating it for one of the companies, she was requesting for the Black community to come out so that they could tailor it for different genetic makeup. But of course, like Anita was saying earlier, just didn't have enough Black people that were really ready to do something like that at that particular time when they were trying to create it. So we get what everybody gets at this
Yeah.
point.
I don't necessarily think that it would be. I mean, they haven't exactly come out with anything that says this is more effective in white people than Black people
Yeah,
and Asian people, and
but then again, you can't really. I don't think they really would say something like that.
it's possible.
Because then there people will come out and say, "What are you trying to say? We're different."
Hmm.
You know what I mean? We all bleed the same.
I mean, it's not necessarily true because even for lab results, like if you do a GFR on a patient, the way that we predict it for Black people is different from everyone else. So there are different some things in medicine where we kind of consider that. Of course, like Black people are more high risk for certain things like hypertension, diabetes, that type of thing. But um, I think it also is because of our cultural eating habits
Ah,
that
absolutely,
put us
We,
in those.
absolutely.
we tend to have a lot of those positions, the hypertension, the diabetes, make COVID a little bit more. So
Right,
Mhm.
I wouldn't say ineffective. The
right.
only thing that I would be concerned about are maybe some of those side effects like the blood clots or something, but it doesn't seem to be a big issue.
No, yeah.
Chris has a
Is there
question.
a way to tell? Is there a way to tell if I had COVID before?
Yes, with an antibody test.
Ah,
So COVID
I think I had
antibodies.
it last year. No joke. For 3 months, I was sick.
Yeah.
I was like, you know?
But they're saying they don't really know how long the antibodies actually last still. They're thinking it's up to 3 months after you've been infected, but it's still kind of iffy on if that's how long it lasts because people were thinking, oh, if I got COVID, then I won't get COVID again because I just had COVID,
Oh,
You can
no.
be reinfected.
Yeah. It's like the
That does
flu and
happen.
the cold.
Yeah.
Many
People are like,
times
I'm
we
good. I
forget
just had COVID.
What'd you
Yeah.
say, Olu?
chickenpox. I was saying you have to
Right.
think of how many times you probably had the flu. It's not like chickenpox where you get it once and you're done for the rest of your life.
hmm
I mean,
And
I
COVID
wish it was.
antibodies are measurable 7 to 14 days after you get your onset of illness. So that usually should be around the time where, so if you get sick and then you go test your antibodies right then, it's probably not going to show up. So you got to wait at least a week or two.
Yeah, but if you're someone like me where you were sick a long time ago, like November of last year, when my doctor said, oh, there's this new virus, but we're not really sure what's going on. And then 4 or 5 months later, they're like, COVID. And I'm like,
I mean,
Yeah.
2019.
ah.
We're talking 2019 when you say
Yeah,
that. So
2019.
Right. So don't go get your antibodies test now, is what I'm trying to say,
yeah,
from being sick a year ago.
Yeah, it's not going to show up.
It's not going to show
Mm-mm.
up.
Is it possible to be vaccinated and have no antibodies found after antibody testing? Hmm.
Possibly.
I want to say
There's
So,
always a loophole in everything, right?
yeah. So CDC says that because, there are some people that are getting the vaccine and they go, well, I'm just going to go get an antibody test. And if I get
Right.
the antibody test, then I know I'm good. And then, it'll be positive or whatever. The CDC is recommending that you do not use the antibody test as a means to, like, I guess, predict your immunity. Like, even if you decided to go get the booster shot later on. So they say that it's basically because it's uncertain whether certain machines can test for those things. So,
and I'd also add, I know several people who have had COVID more than once. Um, just because you have the antibodies doesn't mean that you can't get infected again. And then there are different strains of COVID. You know,
Right.
I think there's a UK version, there's a South African version, there's a
there are a
Swiss.
lot of different strains.
Yeah, so you could say you
It's
might
like
not
it's
get
evolving.
one.
Yeah.
Exactly. Another one that's more contagious than the other one.
Right.
Hopefully,
Okay.
we can get
But what's our
curtail this
fact of the
before it keeps going crazy. What you say?
I said, what's our fact of the day?
Oh, we have facts.
We already
No, no,
do.
no. Don't you remember our fact of the day?
Oh,
Antibody
the
titers
antibodies.
Oh, the
yeah,
antibody
Yeah,
time.
yeah.
exactly. So go get
True
vaccinated.
that. All right, so we're going to wrap it up. Thank you for tuning in to the Medical Report here with your hosts, Anita, Olu, and Zenzele. Follow us on social media at the Medical Report on Facebook for more information about our upcoming bi-weekly podcast. We hope that you check out our businesses, Interval Care, Bantucola, Graceful Hands, New Life Therapy. Connect with us. We love to see it. We hope that you will tune in again with us in 2 weeks.
We have more topics. Stay black.
Look out for our next